Now, back to Coastal Living on KZTV.
Hey guys, welcome back to Coastal Living. Our first guest today are Elliot Garza. He's the owner of MD Monthly Magazine. You're very familiar, I'm sure. And our new local neurosurgeon, Dr. Schmidt. Thank you for joining us today.
Thank you for having us.
Awesome. So tell me a little bit about yourself, Dr. Schmidt. You're new to town and you're offering something that is the first of its kind here in the Coastal Bend. Is that correct?
More or less. I'm a vascular and endovascular neurosurgeon. So I trained in general neurosurgery, but my specific interests are the arteries and the veins that supply and drain the brain and the spine.
Good. And is that one of the most common concerns that you see when people are having issues with the brain, or is it pretty broad?
Personally, yes, so that's why people would come to me. Then I'll do some general neurosurgery procedures, so brain tumors and things that you have to cover in an emergency department, trauma patients. But really what I'm specifically interested in are any kind of disorder that involves the blood vessels.
And what are some examples of those?
So patients come to me because they have a brain aneurysm. They have something called an arteriovenous malformation, which is a congenital, meaning they were born with a tangle of blood vessels that can be dangerous. If it ruptures, it can bleed, and those patients can be at a risk for death. So those would be patients that would come to see me. Patients who have narrowing of the arteries in their neck. I can do either an open surgery or a procedure where we put a stent up inside the artery. So the endovascular portion of my specialty is that I not only learned how to do the open surgeries, but I can do some procedures through vessels in either the leg or the wrist, where we can treat things from the inside of the blood vessel rather than do a more invasive surgery. So whereas some patients might have to stay in the hospital for up to a week for an open surgery, they can go home the next day for an endovascular procedure.
Wonderful. And we're so fortunate to have that technology available to us today, because it's pretty recent still for us to be able to do that less obtrusive work. And tell me about your experience. How long have you been practicing?
So I've only been in town since July 30th, and I just finally got started with Shoreline in October, sorry, at the end of September.
Okay.
So I just started seeing patients in clinic at the beginning of October, and hopefully no more moving for a while. My wife and I have been moving around a lot the last few years, but we're hoping to finally set roots in Corpus.
Wonderful. Well, we welcome you here with open arms. We are always looking for specialists to have right here in our own community, so we're not having to travel too far with heart problems, brain problems, and things like that to find people that are qualified to treat these types of issues. Now, Elliot, you're always so shy on TV. You meet him in person, he's not a shy guy. Tell me what made you want to bring Dr. Schmidt on?
To echo what you said, to show the best in the Coastal Bend, as far as the traveling patient doesn't have to travel anymore, when you have the best here in Corpus Christi, my mom always said, make sure you're not the smartest person in your group. Now I'm hanging out with brain surgeons now. So,
look at me now, Ma.
Look at me now, right? But it's exciting. I really love to introduce these doctors, especially in Corpus Christi. And what's happening is that, the Shoreline Ocean Drive area it's like a stroke center for preventive health care. So therefore you have accessibility here locally. So it works out.
Wonderful. And tell me, what was it that inspired you to come to Corpus Christi of all places?
It was a combination of professional and personal. So there was obviously a big void professionally that needed to be filled. And then my wife's from New Zealand, and if you're in New Zealand, you're always close to the water. And she was really missing the coastal lifestyle. She grew up on boats, fishing and sailing. She wanted to be near a beach, so as soon as I showed her where Corpus was on a map, I think it was going to be hard to convince her to go anywhere else.
And how is she handling our humidity so far?
Oh, she got broken in Virginia, so she's okay with it.
Pretty quickly?
Yeah.
Awesome.
And he has a brand new daughter too. I'm a fan of daughters.
Congratulations. Yes, you have one of your own. And how old is she?
She was just born in July, so she's 3 months.
Congratulations. 3 months. So you probably stay busy with your profession. And I asked you earlier, I'm not sure if we got the full answer. How long have you actually been practicing as a neurosurgeon? Because you mentioned you were in Seattle before, you were in New Jersey before that.
I was in Seattle finishing up my fellowship training. And then before that, I was in Virginia for 7 years doing my training, plus a year in New Zealand as part of that.
Awesome. So everything is fresh. You've got all the education still up there, nice and fresh and ready to rock and roll. We're very excited to have you here in the Coastal Bend. And Elliot, tell us a little bit more about your magazine and what your incentive is.
Well, MD Monthly and MDmonthly.com is to make sure the general public knows the newest in technology, the doctors that are up and coming as well too. And it's a growing industry. I've been doing this for 13 years now, And it's exciting, just introducing physicians to the market.
And besides the endovascular capabilities that you have now, is there any new technology we can look forward to when it comes to any vascular brain procedures?
Well, it's not that it's a new technology. It's a few years old now, but one of the reasons that they hired me to come to Shoreline was because there were a few papers that came out a few years ago showing that patients who are having strokes, if you can go in and get the blood clot out within a few hours, those patients do much better than if we just manage them medically.
Wow.
So we're trying to create a comprehensive stroke center at Shoreline Hospital. And in order to do that, we need to be able to provide that service 24/7. So I'm kind of one of the first pieces of that puzzle. I'll be hiring a partner in the future to cover another segment of the call because I can't be on call 24/7. But yeah, one of the main reasons they hired me is to do that. So that technology is around, it's available, we're just bringing it to Shoreline.
Amazing. And what would your best advice be to a viewer who may know that they're starting to struggle with these types of concerns, to just act quickly?
Yes, absolutely. Call 911, get on an ambulance, and get to the hospital.
Awesome. Well, thank you so much for joining
Thank
us
you for
today.
having us.
We're excited to have you on the Coastal Bend. Welcome.
Thank you.
We welcome you with big, open, warm, humid arms. And we hope you enjoy your stay with us. Thank you for everything you will be doing for our community. And Elliot, thank you for joining us.
Thank you.
Always a good time.